This is Tony Dattino. I am the founder of the USA Memory Championship, president of Dattino Consulting Group. And I'm here on Wednesday, April 13th, doing my Live with Tony and talking about something I have discussed since the pandemic and the COVID-19 restrictions. And it comes out of the February issue of Science Focus magazine. And in that magazine, and there's an article that comes back to the point of me, you, and intimacy too. And when was the last time you were intimate physically or emotionally or intellectually with someone? So it broke down, and intimacy doesn't mean you had to have sex with them. It meant to mean you had some kind of an emotional connection with someone that resonated with you, that was important. And it could be a friend, it could be a relationship, it could be children, it could be your family members, moms and dads, it could be people that you feel that you emotionally connect with. So it really broke down three elements of intimacy into emotional connection, people that you care about and that care for you, people that support you and people that you support them. It broke down physical, and this is the killer of them, because emotionally, I think we can still connect using tools like Facebooks and YouTubes and ways of getting on Zooms. And I think we can still have some level of emotional connection with people. But when you get to intellectual connection, then now it says, okay, what are we talking to people about that's creating some mental stimulus, some mental challenges in our thinking and problem solving and how we can go about resolving issues and concerns that we have. Maybe it's a doctor's appointment, maybe it's test results from scans or MRIs or lab reports or blood tests. So how do we connect with people intellectually? Maybe on a work problem, on something you're doing in your residence that you want to get some, intellectual capacities on. We can always go to Google, research things on Google. We can always go to YouTube and look for YouTube videos. So again, to that level between emotional and intellectual connection, I think people have navigated and been creative in finding their ways to move about those types of intimacies. But now we get to the physical part. And you say, okay, how do we engage in that piece? And that's a little bit tougher because when we know what our senses are, right? Sight, sounds, smell, taste, and touch, how do we build those of smell, taste, and touch? And in this particular article, it talks about the sense of touch. And what do we lose when we lose the sense of touch? And how those receptors, all these receptors we have in our bodies, in our arms, in our chest, in our face, in our legs, how those receptors are looking for some level of touch. And what I've said during the COVID lockdowns is, boy, when we've locked down kids, and I'm certainly not recommending everybody go running around and doing hugs and touching and whatever, but even the sense of close connection where you have people that are close to you in your proximity and you just see who they are and you're feeling in their space and you feel some level of connection in the relationship, be it a friend, be it a classmate in your school, be it a professional in your work environment. What happens to the body's responses to that, and how the science is now, at least in the Science Focus magazine, is talking about the importance of that physical connection to people. And that's been the challenge of COVID. And unfortunately, a lot of our medical people in their evaluations of the virus and then what the virus does and doesn't do, and locking down people and isolating them, as people now in a survey I was reading out of the new paper today was talking about, people just feel like the COVID-19 is done and over, and they're just going back out into large groups and gatherings. And just within the last week, we can see the number of people in our political world up in Washington, D.C., the number of people that are coming down with COVID because they're into groups of larger settings. So I raise caution to people because of this urge that we have to want to have social connection and have some level of social touch. So you can watch on the TV and the DC conferences, that people wanting to hug one another and just come close and hug. And so now we get to the point of a hug, right? And I found this really interesting because what they were saying in this article and the research that's been done on it, researchers have found that people exposed to viruses, so now you were exposed to a virus, that people who had more hugs in the previous week were less likely to get sick. Here we go again, right? We're worried about viruses. We've been told to keep 6 feet apart. We've kept our mask on. And here comes research that says if you were exposed to a virus, in this case it would be a COVID, or people who had more hugs in the previous week were now I don't know who did this study and how they go about doing it, but what it was going on to say, the doctor that was leading this, or the researchers were doing this, were suggesting that a 20-second hug just releases so many positive chemicals within the human body that it's absolutely disease fighting and illness fighting and stuff. And I say, whoa, what science is teaching us about our own thinking and our own senses and our own capacities of what we can do, it totally mirrors what I've been saying about the human brain for the last 25 years, which is there's so much more that we can do with our own thinking and with our own abilities to relate to people and the factors of our own brain health. That it's absolutely mind-blowing in terms of what research is showing to us that year after year, day after day. So as you know, I'm constantly reading, I'm constantly researching. I've got 4 different other articles that I want to share with you over my next several broadcasts. And the only problem I have with that is I get new mail on a weekly basis and I read new articles. So I reshuffle my priorities. So I'm just reading this one today, sitting at our community pool, which happened to, it's a good sized pool. It's 80 feet long in terms of the lap lanes. So I got to do my laps today. Water was a little chilly, but as I was saying to my other half, I said, we've actually swum every month this year, January, February, March, April. We were in that pool every month, at least 2 or 3 days a month, if not more. In some cases, 2 or 3 days in a week. But we're sitting there, and I got out of the pool and got out of my wet bathing suit, and the next thing I was doing was reading this Science Focus article, and just found this constant importance of social interaction and what it does in terms of as we build connectivity, as we build relationships, and we build trust around the people that we care about and the people that care about us. I just found this important. And then it went on to talk about, well, gee, can we get social interaction? Can we build the social connectivity that we need from technology? So does technology substitute itself for some of this? And to some degree it helps, but to another degree it's not the same. So there's a whole bunch of reports. I am sure they're going to come out within the next 5 years. I wish we could all have that answer today. But what does technology do to us? And I always go back to my own grandchildren. If we're out together, or if we have fortunate enough now to go out and have an outdoor dinner. And I'm an outdoor guy, so I'm only going outdoors for my dinners. A little crazy, yes, but still COVID sensitive. But if we go outdoors, one of the things I ask them not to do is look at their darn iPhones and look at me and talk to me. One of the challenges I see with social connection in hospital work that I've done is when the nurses are keying into their laptop and they're looking this way as they're keying into their laptop, the data they need, people that are sitting lying in the bed feel that they're not being respected or not being listened to. And that's because the person's over here and they're not looking at them eye to eye. So technology, to the level that it helps us do documentation and data recording, technology to the point of being able to talk to people and look at them face to face, eye to eye, has some level of detrimental effects to it because you don't feel respected and you don't feel that there's connection as we do looking at people's faces eye to eye. So these are the things science keeps telling us, and off we go. All of this has a huge impact on our brain fitness and our brain health, and that's why I continue to come back and talk about it as I continue to read and research and study and observe people and watch what's going on during these really challenging times and how people can still stay safe and not fall into illness is what I continue to research. So, and that again, it is my passion in making a difference in people's lives and helping them with their mental faculties, with their physical abilities, and just knowing that they can do more in their lives than they may have ever thought possible, given the right desires and the right methods and systems of learning, and then the ability to practice and continue to utilize that which we are learning about. So that is my Wednesday broadcast. It is Easter week. Friday is Good Friday, but I will be back with you on Friday, and we have Easter coming up on Sunday. So be safe, be smart, keep practicing, and think about some of the things that you can do. In fact, this article even suggested having pets, and even hugging pets, a cat, a dog, or a pet of some sort, is equally beneficial to the hugs of people. So keep on listening, and I'll keep on reading, and we'll see you on Friday afternoon.